Good afternoon, Fitchburg residents. Yesterday marked the first day of National Public Health Week, a week of particular significance as it is happening during the coronavirus pandemic. Please take a moment to recognize the extraordinary public health efforts underway in Fitchburg, our region, and throughout the country. The Fitchburg Health Department consists of several divisions: housing inspection, food inspection, solid waste, nursing, and substance abuse prevention, all of which are ably backed by dedicated clerks who provide ongoing support on a daily basis. I would like to recognize our Health Director, Stephen Curry, Public Health Nurse Dorothy McNamara, and the volunteer nurses who are working tirelessly to provide services during this pandemic. Furthermore, I would like to recognize our appointed Board of Health, Chairman Dr. John Bogdasarian, Ian Murray, and Sandra Knipe, RN and BSN. The board continues to maintain, protect, and improve the health, safety, and well-being of the people of Fitchburg. I'm happy to report during the weekend, our Board of Health established a COVID-19 hotline. As part of the Montechusett Public Health Network, this hotline is staffed with several volunteer nurses and medical residents who will answer COVID-19 questions for residents of Fitchburg and communities made up of MPHN. Community members can call 844-968-3323 with phone availability 24/7. In addition to the hotline, Mass Department of Public Health funded MPHN with an amount of $200,000 to help assist Fitchburg and the network fight the COVID-19 crisis. As of 1 p.m. today, there are a total of 66 positive COVID-19 cases in the city of Fitchburg, of which 18 are now recovered. It is important to note that the Board of Health is now seeing a trend of quarantine cases testing positive. This is an important reminder of how contagious this virus is. Remember, if you are quarantined, you have had potential exposure to a positive confirmed COVID-19 patient. I urge quarantine residents to not leave your home unless to seek urgent medical care. In the event you call for medical services, please disclose to 911 dispatch that you are quarantined so that they may take the proper medical steps to answer the call. In the event you are ordered isolated, it means you are a confirmed case of COVID-19. In addition to the quarantined orders, please understand that you are a heightened risk of exposure to others and must stay isolated until you are fully recovered from the virus. If we collectively work together to follow these orders and conditions, we will all help play a role in stopping the spread of the virus. For the past week, city departments have been working with staff from our Father's House to open a quarantine location for our homeless population. This location will allow for on-site showers, toilets, and hand wash stations. With the help of the Department of Housing and Community Development and Massachusetts Emergency Management Agency, our Father's House is seeking additional assistance from volunteers to help in various roles. If you are interested in helping, please email our Father's House at info@ofhshelter.com. More details will be forthcoming over the next few days. Last week, with the assistance of our Department of Public Works and our legal department, I filed an order to the City Council that would allow the city to enter into an agreement with Massachusetts Water Wastewater Agency Response Network. The purpose of entering into this agreement is to support and promote statewide emergency planning, preparedness, and coordinate response activities and share resources during emergencies among water and wastewater facilities. I look forward to Council's approval of this agreement, and I thank them for their cooperation. In addition to the DPW, city departments have continued to make adjustments to their business continuity plans as to maintain services with essential staff. In particular, the men and women of the police and fire departments have maintained staffing for operational needs, have developed plans and protocols, and have worked with agencies such as MEMA and Fitchburg State University Police Department for coordination and emergency preparedness. I am pleased to report, as part of the federal government's CARES Act, the city of Fitchburg will receive an additional $586,047 for our Community Development Block Grant. CDBG provides direct federal supports to local governments so cities can develop solutions that work for them. In a crisis such as this, additional CDBG funding will allow us to meet critical needs in Fitchburg, such as support for small businesses and vulnerable citizens most affected by this crisis. We will look to focus this funding in areas of community-identified need and areas where we can leverage these dollars with other community supports to expand our impact even further. On Friday, the governor signed an act to address challenges faced by municipalities and state authorities resulting from COVID-19. This bill assists cities and towns with a broad range of governance and budgeting issues during this COVID-19 emergency. Currently, our city treasurer is working with the Division of Local Services on implementing the finance provisions of the bill as we wait for DLS's guidance and information. Also, our city clerk is in the process of notifying businesses licensed to sell alcoholic beverages on premises that they may now sell sealed containers of alcoholic beverages for off-premises consumption as part of takeout food transactions. I would like to thank the governor, his administration, and our state delegation for acting quickly on this bill to provide relief to municipalities such as our city. Yesterday, the governor reported that early data sets are revealing the measures Massachusetts has taken to combat the spread of the virus are showing signs of improvement in slowing the spread of COVID-19. Although this news is cautiously optimistic, this does not mean we change our mission and the new changes to our lifestyle. We must actively continue to stay at home, practice good hygiene, and social distancing. I would also ask, while I'm happy to see residents protecting themselves with gloves and masks, please dispose of them properly. This is a team effort, and part of that effort is cleaning up after yourself and not leaving it for someone else to do it for you. I would like to close today's updates by once again recognizing Fitchburg businesses doing extraordinary things. Sal Emma of Teacher Lock traditionally manufactures specialized locks that are placed in schools to help protect students and teachers during times of an emergency. However, during this emergency, Sal and his team have changed the production of their 3D printers and have begun manufacturing respirators for healthcare providers. Owner of JR Glass, Ryan Bissett, also has his team putting their skills to the test by manufacturing intubation boxes out of polycarbonate material for surgeons and hospitals. In addition, JR Glass is making counter guards to help protect those workers in retail settings during customer transactions. This is yet another example of a small business making a large impact, and we thank them. Several weeks have passed, and many decisions have been made. Yet our first responders and municipal staff continue to provide the services we need to maintain a functional community. I'm abundantly thankful for their efforts, and their dedication to our city. Thank you.